Welcome to the Profile Series. My name's Terry Duenas, and we're here with some very interesting guests, and we've had Heidi Nelson, the Executive Director of the Duffy Health Center. Have I got the name correct on there, Heidi?
Yes, you do, Terry.
Good. And we were just saying, I've always got to get her in more because she always is doing such interesting things. And to her left is Dr. Wesley Klein, who is, Dr. Klein, what is your position or your tie with the Duffy Health Center?
I'm the new medical director.
Absolutely. Well, then we're really excited to have you here with us to talk about how important Duffy is to the community and how exciting, what exciting new things you're trying to do. So welcome, Heidi. Welcome,
well,
Dr.
thank you,
Klein.
Terry.
It's great to have you. And the first thing we should do is, you know, we always think, well, everybody's going to know what the Duffy Health Center is doing, but we forget. They don't. You know, and we go and you reach. So explain to us a little bit, Heidi, what the mission of the Duffy Health Center is.
The mission of Duffy Health Center is to prevent and end homelessness through health care.
Great.
We offer a unique blend on Cape Cod of medical services along with mental health treatment, substance abuse treatment, and then also case management, which are services that wrap around individuals who have the most significant challenges finding and keeping housing.
Fabulous.
Last year we served 3,000 people, believe it or not.
Are you really?
People are amazed that there are that many people who meet the criteria for our program, but in reality there are many, many more people that we could be reaching with our Duffy services.
Terrific. You know, and it's so good to see all the integrated services that you're doing in addition to the really upfront health needs, but the other things like the mental health services and the variety of things that you provide. That's wonderful. So 3,000 people qualify.
Right. And you know what's interesting, we like to talk about the numbers of people that we serve, but more importantly, we like to talk about the outcomes of the care that we provide.
Beautiful.
So we look at things, and Dr. Klein is in charge of the quality of the care that we provide, but we look at, for example, we have about 350 patients at Duffy with a diabetes diagnosis. 2/3 of those patients have their diabetes under control through our care. We have about 750 patients with a hypertension diagnosis who have their blood pressure within normal limits. 2/3 of them have their blood pressure within normal limits through our care. About 50% of our adult women get the regular health screens that they need, which is room for improvement. We want to do better on that. And we housed 60 people last year.
That's wonderful. Now, Dr. Klein, are those numbers of people with diabetes, hypertension, are those in the homeless population something that goes pretty much unnoticed? Or
They can. A lot of people may have been diagnosed years ago. They had a doctor, but let's say they lost their insurance or something happened and they might have been out of care for years, sometimes decades.
Sure.
And they come in very out of control, maybe with damage from the disease that's permanent, things like that. So yeah, no, it's very prevalent to see patients with multiple chronic problems.
And you mentioned 3,000 individuals that you've seen over the last year, for example. What type of criteria do they need to qualify to go in? If somebody's at home watching and they say, well, you know, I don't have health care insurance and I don't, I'm low income, or, I don't know if people, everybody thinks they're low income, but I'm at risk. What can they do to come in and see you?
So really, anybody who is low income and has any form of public insurance, so people who have Mass Health as their insurance, or they receive their insurance through the new Connector Care, which is the subsidized insurance products, and residents of Barnstable County are eligible to come in for services at Duffy. And really what we specialize in are people who need the mental health treatment and the substance abuse treatment, along with the medical services. That's really what we specialize in.
Great. And if somebody has a question, should they come in and see you?
Absolutely.
So
Sure.
they should come in first and
Or they can call, and we can schedule an appointment for them to come in and meet with one of our intake specialists and talk about the services that they need and the services that we provide.
wonderful. And Dr. Klein, how long have you been
Since
with
August.
us? Since August. Great. Well, that must be a huge addition.
Well, certainly it was. I think on this show I've talked before about the challenges that we have on the Cape with recruiting physicians and nurse
Absolutely.
practitioners to the Cape. We're very fortunate that we partner with Cape Cod Healthcare. They help us with our recruitment, and that's actually how we found
Great.
Wesley. Because sometimes physicians don't know about community health centers, and they approach the hospital looking for opportunities. And so the recruiting department at the hospital, if they find somebody who they think would be a good fit to work at a community health center, they refer those folks to us. So that's how we found Wesley, and we're very grateful.
They need an all-around big hitter that can do a lot of things.
Yeah.
I think that's one of the parameters to working with the population that you're dealing with. Do you find it particularly challenging if you haven't been doing this type of had this type of practice?
Yeah, yes and no. I mean, the truth is anybody practicing has people with addiction problems and mental health problems. It's just more apparent and more acute, I think, here. So, yeah, I think it's a little tough. It's not your typical suburban practice.
Wonderful.
But no, it's interesting because the people that come in, you really feel like you can do something. I mean, there are sometimes I used to feel like, well, they really don't need a doctor. They just need someone to pat them on the back and say everything's fine. But these people really do need somebody. And so there's a lot more illness burden, call it disease burden. There's a lot more mental health issues, substance abuse issues. So yeah, you kind of feel like you dig in and the patients are actually great. They're so appreciative. They're so, they really are the kind of the salt of the earth people. They're trying their best and trying to get through. So you just try to help them when you can.
Excellent. And Heidi, what type of programs? I realize that you've been looking at the population and your clientele and saying, what can we do to better serve them? How can we better serve Cape Cod as a whole? Now, you have a bunch of different and new programs going on right now. What are examples of some of the pieces that you're doing?
Well, interestingly, we operate very much from a public health model. So what we try to do is look at the needs of the population and then design our services based on the needs of the population. We moved into our new building at 94 Main in Hyannis in April of 2011, so we just sort of had having our third anniversary of moving into the new building, and that gave us 50% more capacity than what we had in our older facilities. So we have the ability to take care of more patients than we have been able to before.
Fabulous.
And one of the things that we've been looking at with our board of directors and with our leadership and our staff is the really shocking increase in poverty on the Cape and in Barnstable County over the last few years. In 2006, the percentage of people on the Cape who lived below the poverty level was 6% of our population. 4 years later, in 2010, it was 11%. So it almost doubled in a short period of time. And of course it was during the recession, so of course we had a number of people because of the economy slipped into poverty. And the poverty situation has improved slightly, but we're still between 9 and 10% of our population that's below 100% of the federal poverty level. And just to give you a sense of what those numbers are, that's a single individual living on less than $11,000 a year, and a family of 4 living on less than $24,000 a year. So that's a very, very poor income level. And so to have 11% of our population, and that equals 22,000 people
On the Cape that are living below the poverty line.
below the poverty line. And so where we think that we can have an impact is by creating community awareness and doing outreach and education with the community about the services that we provide at Duffy. So more people We have done a really good job over the last 20 years of taking care of those folks that people consider the literally homeless, people
Sure.
that stay in the homeless shelter, people who live in the camps, people who wander up and down Main Street. And there are about 700 or 800 people that we serve every year that meet that sort of literally homeless definition.
Absolutely.
But there are many other people who are poor and unstably housed. They may be living in an apartment, but their name is not on the lease, so they could be kicked out at any time.
Sure.
We have a lot of situations on the Cape where your aunt or your uncle might let you stay in the cottage in the back.
Certainly.
If you've run into hard times, but then when May rolls around, you get kicked out. Somebody who's sleeping on somebody else's couch or even in their spare bedroom or in the basement room, but that's really not their permanent place to live. Those individuals are all people that we can reach out to and serve.
And they really seem like the at-risk population
That's
that you deal with all the time. It seems like we've been dealing with this problem of homelessness on the Cape for so many years. We're not going to eradicate homelessness. I think what you said when we were just chatting off camera, that if we can kind of eliminate the I can't remember what you exactly said, but the potentially homeless,
Right.
the folks that are near homelessness,
Unstably housed.
Unstably
Yeah.
housed is such a great, a great description
Yeah.
of that, because it certainly makes sense that if we can deal with the services and provide them before they become, I suppose it's easier to eradicate homelessness if you can catch it before they are homeless,
Right.
and do that. You've always worked with the emergency department at the Cape Cod Hospital, but now you are working even more collaboratively with the emergency care center?
Right. It's interesting, Massachusetts has been the leader across the country in health reform. And we spent our first 8 years now expanding access to health insurance. Now, what the challenge is for us to reduce the cost of care, and it's through better management of our patients.
Wonderful.
And one of the things that happens, particularly with our population, is if they're not engaged in care at Duffy or another provider, they can overutilize services like, for example, the emergency department at the hospital.
Absolutely.
So we are actually part of a national project. There are 8 healthcare for the homeless programs across the country that got money from the federal government to utilize a concept that we call community health workers, which are people who have lived experience, in our case, of serious mental illness and drug and alcohol issues, that know how to relate to the population that we're trying to reach out to. We sat with the hospital and we asked them to identify the 40 people who are the highest utilizers of emergency department services at the hospital, who have had some interaction with Duffy in the past. And so our 2 community health workers have been focusing on that list of individuals.
Wonderful.
So we now have about 13 patients in the program, and that may sound like a small number, but these are really, really tough people to outreach and engage to. And I always tell this story, it's kind of funny that you always want to go to the first person on the list. What we figured out through this project is you should actually start with the 15th person on the list.
First one you'll never.
You can have some success. And so we enrolled 12 people in the program, and then number 13 turned out to be that number 1 person on the list. So we actually did bring that person into care. So we're working with the hospital now to quantify before they enroll, the patients enrolled in the program, and then when the program is done, we'll look at after they were enrolled in the program to see if our intervention made a difference in the cost of care.
I think it has to. I mean, it seems like such a no-brainer that it has to, because if their first sense is to, let's go to the emergency room, that's the most expensive and the biggest bottleneck in care going. And so I think that's a great program to be involved with, and I bet the Cape Cod Hospital loves you because of that.
Well, and they're putting in some new programs too at the hospital where they're having more psychiatric providers in the emergency department
Great.
because a lot of these folks
Yeah.
are people that have untreated mental health
Chronic
and substance
mental illness
abuse
and substance.
issues.
Yeah, it's a huge combination, and I think this is the first. I think with your attacking the problem, you really look at the whole piece, which makes such sense. You know, such a great way to do it. One other piece that we want to talk about before we let you go, to promise is make you promise that you'll come back for one thing.
Sure.
But is your new day center, because in our previous iterations of care for the homeless, they kind of like, NOAA was great, the nighttime operation assistance housing, whichever.
Yeah.
There's a lot of things. Did NOAA really come from that? But it gets them out during the day. Well, sometimes there's no place to go, and that creates more of a problem. What will your new day center be?
So we're working with a group that is made up primarily of people who were involved in the Main Street Initiative, which is something that we've talked about before.
Absolutely.
4 years ago, there was a lot of furor around what was going on Main Street. And so we coalesced as a community. It's a beautiful thing. You don't see this very often, where you've got the police, elected officials, the human service providers, and the merchants and the business community all coming together to solve this problem. And through that effort, we identified 93 people who were problematic on Main Street. And through our collective efforts over a year and a half, we got that number down to less than 25 individuals. Wow. And those people who work with street people have been continuing to meet on a monthly basis. Some months the number is higher, some months the number is down to 12 people, but we're never at that sort of 93 level where we were before. So now what we want to do is continue to reduce that number, that there's no reason in our society why people should be living on the street. And NOAA is a very important resource in the community, but it's a nighttime shelter. So you line up at 4 o'clock, 4:30 to get a bed at the shelter, and then you have to be out by 8 o'clock in the next morning. And so it's very grinding on our people that they have to get their stuff in bags and off they go, you know, trying to find a place to stay warm. And it's very unsettling. And how can you make forward progress in your life if you're, you know, constantly moving around? So this multidisciplinary group of stakeholders, diverse group of stakeholders, is working now on this idea of having a day center, which would be transform the NOAA shelter into a 24/7 program. So this is not just a project of Duffy. Housing Assistance Corporation and Duffy and many other stakeholders are working together on this project, and we're very excited about it.
I think that's fabulous.
We're going to experiment with a few little things this summer because we don't have a facility yet, but providing activities and places for people to be during the day so they'll be off the street, which of course the merchants love because it's not good for business, you know, to have a lot of people on the street. So we're very excited about the possibilities.
Well, I think that you really need to be commended in doing that work to try to bring all those stakeholders together, because it has been such a situation where the merchants felt one way, the healthcare providers felt another, and plus there was all these different little groups and organizations, all had great ideas and really were doing the right thing, but they had no overall focus, and I think that you're providing a lot of that focus, and really will. It's a great thing, and it's going to, make a difference in a lot of people's lives. So again, Heidi Nelson, thank you very much for joining us. And we're going to get you back. You promised already. You heard her, Dr. Klein.
I did hear.
She promised that she would come back and tell us about the new initiatives and what's going, especially as we get closer to the summer. Dr. Wesley Klein, welcome to you've been here a while I know, already, but it's welcome, and it's great to have you in our community. You're a needed breath of fresh air to be able to come in and provide some even more leadership at the helm of Duffy. Thank you very much.
Thank you.
Thank you for joining us. We appreciate it. Catch us next time on Profile, and watch for the exciting new things coming up at the Duffy Health Center. Thank you.